call to arms. A murderous second wave is underway, and so time for a stringent national lockdown.
J'ai décidé qu'il fallait retrouver, à partir de vendredi, le confinement qui a stoppé le virus.
Clear echoes of France's first wave as travel restrictions return, but there are differences. This one will initially last for 5 weeks, and schools and essential workplaces will remain open. Some of the toughest measures in Europe, as Germany, for long a model in handling the virus, also announced a dramatic tightening of restrictions.
Deshalb ist vollkommen klar, wir müssen handeln, und zwar jetzt.
The new measures by such close neighbours will intensify pressure on Boris Johnson to toughen restrictions on this side of the Channel. The UK is, after all, projected to be a few weeks behind France. And the Scientific Advisory Group for Emergencies is warning that the second wave could last longer than the first. In the spring, the UK daily death rate quickly shot up to just over 1,000 a day before slowly coming down. Since September, deaths have been on the up again, and now scientists fear they will rise to 500 a day by mid-November. The numbers could then plateau.
We're already seeing a steady increase in infections, hospitalizations and deaths, but at a far slower rate than we saw in March, maybe doubling every 2 to 3 weeks. But it is carrying on in spite of the measures that have taken place. So this is going to carry on increasing. It's quite plausible that it will carry on really throughout the winter. I think it's going to look much more like a bad flu season, which is spread over the whole of the winter rather than being enormously packed in like the first wave of this epidemic.
A significant moment for Boris Johnson, as his own scientists warn of the potency of the second wave. And political pressure too, after the EU's two mighty powers introduce nationwide measures. Downing Street is watching developments across the Channel with care, but for now, the Prime Minister believes that targeted regional restrictions are the best approach over here.
We need to look carefully at what other nations are doing, but recognising that this government is up against it once again. But we need to learn lessons from that first time round, understand that there may be a circuit breaker or another lockdown, but actually we're keeping more people alive at the moment, there's medicines available, we're all more disciplined in what we're doing. And what I'd like to see is not an exit strategy as such, that won't come until we have a vaccine. What we need is a plan for 6 months. We're going to have a tough winter, there's no doubt about it. We need a plan to take us to March. That must include keeping the economy alive, looking at clever ways of allowing us to go about our business.
Labour believes the new restrictions on the continent highlight weaknesses in Number 10's COVID response.
I think, again, it shows that Boris Johnson is behind the coronavirus curve. He should have used this half-term for a short time-limited circuit break here in the United Kingdom, in England, to get on top of the virus, to save lives, to stop the NHS being overwhelmed. And the fear now is that because he's divvying, because he's delaying, that he'll be forced into a longer, deeper lockdown later next month or in December. Again, it's because Boris Johnson, like in the spring, has been too slow to act.
An eerie silence befell the City of Lights in the first lockdown, and now a return to those dark days.
Nick, well, I'm joined now by Robert West, the Professor of Health Psychology at University College London, who's also a member of the Behavioural Science subgroup of SAGE, SBIB, and Clare Wenham, Assistant Professor of Global Health Policy at the London School of Economics. Good evening to you both. First of all, Professor West, in July, Boris Johnson said, "It's my strong, sincere hope we'll be able to review outstanding restrictions and have a significant return to normality end of November, possibly in time for Christmas." It's not going to happen, is it?
I'm afraid it isn't, and unfortunately this was foreseen, when the restrictions were eased. People were saying they were eased too soon and too much at one time, and then as things started to get worse, we needed to act much more quickly than we have done.
So, In the beginning, let's look at the first wave. We were told that we had to protect the NHS, but actually it became the COVID NHS. And as we now know, cancer operations were cancelled, cancer deaths rose. We've heard tonight that Greater Manchester is again cancelling cancer operations. So is it time for a more explicit message? If you do not adhere, everybody knows someone with cancer in a family, there will be more cancer deaths.
If you do not adhere, I mean, this is the thing. What we're seeing from the evidence is that people are adhering to what they're being told to do. The problem isn't so much the adherence to the rules. The problem is the rules. And the fact that
and the explicit nature, is it not time to be more explicit in that message about cancer?
Well, I think it's very important to understand that the NHS was not protected last time. It was absolutely catastrophic for the NHS, and it will be again. There's no question about that. But independent SAGE, now SAGE has said, that it really isn't acceptable to have a continuing rise in infection rates because, we will see more hospitalisations and deaths, and the NHS, of course, will suffer as a consequence.
And frankly, in the midst of deep winter, might not be able to cope. I mean, it was seen as a triumph that we weren't using the Nightingale hospitals. But actually, that's not necessarily a triumph for other kinds of illnesses as well.
No, I mean, we will see, we've already seen that there were substantial excess deaths, not directly caused by COVID, and there will be more to come.
Clare Wenham, why do you think people are often not adhering to the measures? Is it the fact that they're not scared, or they're too scared, or they've got competing scarednesses? For example, they're scared of COVID on the one hand, they're scared of a lockdown on the other, they're scared financially.
I think it's a mix of all those things. I think some people are fed up of being where we are and fed up of being in this kind of quasi state that we've been in for the last few months. I think others simply can't afford to go to isolate. We've seen a lot of data coming out showing the people who aren't able to abide by these isolation requests are because they have to go out to work. And I think also we've had a government who's been, encouraging people to go out over the summer. Let's not forget that the government were encouraging people to go out and, eat out and go back to work and trying to get people to socialise again. And so there's really some mixed messages coming that people are trying to have to, grapple with at the moment.
But now and today, we've got this stubbornly high number in the early 300s, expected to rise to about 500 in daily deaths. Now is the time, surely, to have trust between the government and the public. And why does the public not trust the government?
Well, so I think there's been some challenges in the risk communication across the course of this pandemic. I think that, Johnson's message at the beginning of this, it would be out of this by Christmas, was unrealistic. And I think he needed to prepare people better for actually, this is going to be a long time till we're out of this. And, nobody wants that answer. It's not a political, astute or savvy thing to say. It's not going to win you, a crowd. But that's the reality. And I think we now need to get that messaging right to prepare people for what's going to be a long winter, potentially a long 2021. And also prepare people for the fact that the vaccine isn't necessarily the silver bullet. And, as soon as we get a vaccine, it's going to take time to distribute it, to roll it out. And so I think we need to really focus in on how the government is communicating what the reality of the next few months and years might look like for us.
What is the reality, Robert West, of the next few months? Is the reality to follow France and Germany into a national lockdown?
Yes, I think that it would be remarkable if the government sort of held out. And unfortunately, the longer it leaves it, the longer the lockdown will have to be, and the more people will die ahead of that. It's really painful. But the other thing, if I may say...
You're advising the government on this, and you're the one that's saying, look, get into that lockdown now.
Yeah, well, scientists advise, governments decide. But the other thing that's really important to say about this is that the test, trace and isolate system has to be up to standard, and it isn't. And that's been the really catastrophic failure over the summer and since then, is not getting that system in place, because lockdowns don't work by themselves, they just buy you time.
It's interesting, as a behavioural psychologist, looking at, we've now got this mixture of tiers, and proliferation of tiers, 5 in Scotland, 3, 4 here. Is your sense that just doesn't work, all these different tiers?
It's not going to work. And the problem is that if you have the infection rate rising across the country, which it is, then you might be in tier 1 now, but you're going to be in tier 2 later. And it's much better if you have the whole country in one boat, as it were, controlling the infection in the same way.
So I want to ask this to both of you. How do you create a new social contract between the government and people? How do you create a new message about this?
I think that the government has to accept that it's got it wrong. Other governments have said that. You know, you've got to be willing to accept that you've got things wrong. You've got to be honest with people. You've got to be transparent, and you've got to have very clear messaging about what needs to be done and why it needs to be done.
But we understand, Clare Wenham, Nick Watt, our political editor, understands that the government is not minded to go into national lockdowns. Is that now a mistake?
I think it's difficult. I mean, look, nobody wants a lockdown. I don't think anyone in the UK wants to go into lockdown again because, you know, in general. But I think the reality is there's little choice. And I agree that we need to level with people and tell them that, you know, the tier was an opportunity to demonstrate that we could get this under control. And the fact that people haven't been following it, the fact that people are confused about what they're supposed to be doing is simply, you know, showing us that there's not really another way than a national lockdown.
But is there a question that if people do not feel financially secure, if people do not feel that they can actually stay at home and feed their family, they'll do anything to make sure that they can?
Absolutely, and that's why we have to think about this, not purely from the epidemiological case data, but we've also got to look at making sure there are economic stimulus packages in hand, making sure people have got the resources in place to be able to lock down, both as individuals or at businesses. And we have to take a much more holistic view of what the impact of a lockdown will be. It will be regressive. They always are. Lockdowns we've seen across the world have had significant social and economic costs, but we have to weigh that up against the reality of you know, lots and lots more people dying, which is something we can't live with.
Robert.
Absolutely. That's the third part of the package. So you have the circuit breaker or the fire break, you have you buy time to give you a decent test, trace and isolate system, and you have good adequate financial support for people so that they can actually obey the rules. And that's, you know, those three things are critical.
Thank you both very much indeed.